This part introduces Part 4, which includes rules on medication, communicable disease, biocontaminants, diapering, food safety, allergies, and emergency procedures. Notes before starting. Except for definitions, records, and transportation, all rule numbers are new. We have 2 heading above each rule. Amended equals the rule was changed. New rule equals the rule is new. Medication, Part 1 of 2, R 400.1931 amended. 1. Medication, prescription or non-prescription, must be given to a child in care by a licensee or a child care staff member only. A child care assistant or supervised volunteer shall not give medication to a child in care. This amendment clarifies that only the licensee or a child care staff member may give medication. Child care assistants and supervised volunteers are not permitted to administer medication. Medication, Part 2 of 2, R 400.1931 amended. 6. A licensee or child care staff member shall give or apply prescription or non-prescription medication according to the directions on the original container unless otherwise authorized by a written order of the child's physician or healthcare professional. 9. The records required in this rule must be retained for a minimum of 2 years. This update allows written orders from healthcare professionals, not just physicians, and reduces medication record retention from 4 years to 2. Biocontaminants, R 400.1932 New Rule. 1. A child care home shall use standard precautions regarding prevention, exposure, and disposal of biocontaminants. Physicals, R 400.1933 amended. 1. An applicant shall obtain a written statement, signed by a licensed physician or healthcare professional, or the healthcare professional's designee, within 1 year before issuance of the initial license, that attests to the applicant's mental and physical health. The attestation must be renewed at the time of subsequent license renewals. 5. The documents required in this rule must be retained by the licensee for a minimum of 2 years after the date the individual no longer resides in or cares for children in the child care home. This slide notes that the previous TB testing requirement in R 400.1919, 4, has been rescinded and is no longer required. Water activities, R 400.1934 amended. 7. If there are 2 groups of children, 1 group in the water and 1 group out of the water, then the staff-to-child ratios, as required in R 400.1927, must be maintained for each group, with the exception that the staff-to-child ratio for children under 3 years of age who are in the water must be 1:1 at all times. This amendment clarifies change from personnel to staff, for clarity. Diapering, Part 1 of 2, R 400.1935 amended. 2. The designated changing area must comply with all of the following. E. Be cleaned and disinfected after each use. G. Have a plastic-lined, tightly covered container that is used exclusively for disposable diapers and diapering supplies that must be emptied, cleaned, and disinfected at the end of each day. This update requires diapering surfaces and containers to be cleaned and disinfected after each use, replacing older language that referenced sanitizing only. Diapering, Part 1 of 2, R 400.1935 amended. 7. If toilet learning equipment such as potty chairs and modified toilet seats are used, then both of the following apply. A. They must be able to be easily cleaned and disinfected. B. Potty chairs must be cleaned and disinfected after each use. This amendment requires potty chairs and toilet learning equipment to be cleaned and disinfected after each use. The wording was updated for clarity and consistency with standards. Staff handwashing, Part 1 of 2, R 400.1936 amended. 1. All personnel and volunteers shall wash their hands appropriately and at all of the following times. A. On arrival for the workday. B. Before caring for children. C. Before and after preparing and serving food, eating, and feeding. D. Before and after giving medication. E. After each diapering. This update expands handwashing requirements to include volunteers and clearly lists when handwashing must occur, such as on arrival, before caring for children, and before and after food handling or giving medication. Staff handwashing, Part 2 of 2, R 400.1936 amended. 1. All personnel and volunteers shall wash their hands appropriately and at all of the following times. F. After using the toilet or helping a child use the toilet. G. After handling bodily fluids, such as mucus, blood, vomit, from sneezing, wiping, and blowing noses, from mouths, or from sores. H. After handling animals and pets in cleaning cages. I. After cleaning or handling garbage. J. When soiled. Ensuring children wash hands, R 400.1936 amended. 2. Personnel and volunteers shall ensure that children wash their hands at all of the following times. Hand sanitizer use, R 400.1936 amended. 3. Hand sanitizers containing not less than 60% alcohol or single-use wipes may be used as a temporary measure during outings, such as field trips and outdoor activities, until soap and running water are available. Special considerations for handwashing, R 400.1936 amended. 4. When an infant is too heavy to hold for handwashing, cannot stand safely to wash hands at a sink, is not developmentally ready to hold their head up, and for children with a disability who are not capable of washing their own hands, staff may wash the child's hands with non-toxic disposable wipes. Food Allergy Plan, Part 1 of 3, R 400.1937 New Rule. 1. A written plan for the prevention of and response to emergencies due to food and allergic reactions must be developed and implemented to include a child care plan, prevention measures, and emergency procedures. 2. The child's care plan must include all of the following, at a minimum. A. The child's name with a list of their food allergies. B. The names, doses, and methods of medication administration the child must receive in response to a reaction. C. Training on the recognition of the child's allergic reaction. Food Allergy Plan, Part 2 of 3, R 400.1937 New Rule. 3. The child's care plan must be carried on field trips. 4. The prevention measures must include all of the following, at a minimum. A. Notify parents and guardians of all children in the child care home to avoid bringing in foods to the child care home with the known allergen. B. Post the child's name and known food allergy prominently in the child care home, upon parent approval. C. Train staff on the symptoms of anaphylaxis. D. Prevent food sharing between children. Food Allergy Plan, Part 3 of 3, R 400.1937 New Rule. 5. The emergency procedures must include all of the following, at a minimum. A. Promptly and properly administer medications in an event of an allergic reaction according to the instructions in the child's care plan. B. Contact emergency medical services immediately if any child has a serious allergic reaction, new suspected serious allergic reaction occurs with any child, or whenever epinephrine has been administered, even if the child appears to have recovered from the allergic reaction. C. Notify parents or guardians immediately of any suspected allergic reactions, the ingestion of the problem food, or contact with the problem food, even if a reaction did not occur. Food Preparation and Service, R 400.1938 amended. 1. A licensee shall ensure that all of the following requirements are met. Each child shall be provided with nutritional and sufficient meals and snacks that meet the requirements for meals of the child care component of the USDA Child and Adult Care Food Program, as referenced in 7 CFR 226.20. This sub-rule does not apply to children whose parents provide their food. Bottle Warmer, R 400.1938 New Rule. 16. A child shall not be held while removing a bottle from the bottle warmer. This new rule states that children may not be held while removing a bottle from a bottle warmer to prevent burns and scalding. Emergency Preparedness Part 1 of 6, R 400.1939 amended. An applicant or licensee shall develop and implement a written emergency response plan and procedures for the care of children for all of the following emergencies. E. Floods. F. Power outages. G. Extreme weather. H. Other natural or man-made disasters. I. Bomb threats and other man-made emergencies. J. Intruders or active shooters. Emergency Preparedness Part 2 of 6. R 400.1939 amended. 2. The written plan and procedures must include all of the following, as applicable to the type of emergency. F. A plan for continuing operations during and after an emergency. H. A plan for how children with a disability will be accommodated in all types of emergencies. Emergency Preparedness Part 3 of 6. R 400.1939 New Rule. 3. A hard copy of the plans must be posted as indicated below. A. The plans required by subrules 1A to E of this rule must be posted in a place visible to personnel, volunteers, and parents. B. The plans required by subrules 1F to I of this rule must be maintained in a place known and easily accessible to personnel, volunteers, and parents. C. The plan required by subrule 1J of this rule must be maintained in a place known and easily accessible to personnel and volunteers. Emergency Preparedness Part 4 of 6. R 400.1939 New Rule. This slide provides a visual breakdown of which emergency plans must be posted, which must be accessible, and which must be available to staff and volunteers. Emergency Preparedness Part 5 of 6. R 400.1939 New Rule and amended. 4. Training on the written plan and procedures for emergencies in sub-rules 1A to J of this rule shall occur in the timeframe indicated in sub-rule R 400.1923. 1. 5. A licensee shall inform all staff of the overall emergency response plan and of the licensee's individual duties and responsibilities in the event of an emergency specified in sub-rule 1 of this rule. 6. All personnel and volunteers present at the child care home shall be trained on and will participate in the drills held during their presence at the child care home. Emergency Preparedness Part 6 of 6. R 400.1939 amended and new rule. 7. Fire drills, using smoke detectors as the alarm, must be practiced while children are in care not less than every 3 months. 8. Not less than 2 tornado drills must be practiced while children are in care between March and November. 9. Drills for other emergency plans not listed in subrules 7 and 8 of this rule must be conducted annually. 10. A written log indicating the date and time of each drill, including the time taken for an evacuation, as applicable to the emergency, must be maintained on file at the child care home pursuant to R 400.1906. 5. Department notification required. R 400.1941 New Rule and amended. 1. A licensee shall make a verbal, electronic, or email report to the department within 24 hours of the occurrence of any of the following. E. The child care home is evacuated for any reason. 2. If a child in care dies, a licensee shall do both of the following: immediately report it, in person or via phone, directly to the child's parent. B. Reported to the department within 24 hours, via phone. 5. A licensee shall keep a copy of the report on file for a minimum of 2 years. End of Part 4. This concludes the end of Part 4 General Health and Safety video.